This is a very important program. Moms really need the support.
We are at Augsburg Park in Richfield, and we're here to celebrate World Breastfeeding Awareness Month. It's a chance for our peer counselors to meet with their moms. Anyone who is in the WIC program is eligible to have a peer counselor if they're pregnant or if they are breastfeeding until baby is a year old.
I think it's so important because, one, breastfeeding is important. Children's health is important.
During the first days of my baby being born, I did have a lot of difficulties with latching, and I was almost about to give up on breastfeeding, but thanks to my peer counselor, I didn't give up. She was very helpful and just gave me so much information, affirmation.
When I was ready to give up, I just knew that all I had to do was just pick up that phone and call and ask for help. You build that trust, you build that communication, I think that's very important, just to be there without judging.
It's a very important resource to have at your fingertips because motherhood is incredibly challenging, and even if you do have more than one child, every baby is different. With one child, maybe they latched great and you really enjoyed breastfeeding. Maybe with another, it was painful or difficult, or maybe you just didn't enjoy it as much. So I think just knowing that someone is there on your team who gets it is really helpful.
We have 6 peer counselors who we have chosen that reflect the community that they serve.
I think it's super important, especially for my community of people of color or Black people, because Black people, specifically, because I can only speak for myself, because I know my history well, we don't have the best history around breastfeeding due to slavery and having to breastfeed other people's babies and not being able to breastfeed our own. And that's kind of like a generational trauma thing. It's like a shared trauma, and it's passed down from mom to daughter to granddaughter. So it's kind of like we have to unlearn these things.
We have so many families from diverse backgrounds who it's important not just for the health of mom and baby, but also the connections socially. Our peers are on call for their moms, nights, weekends. They are available to our families when hospitals and clinics are not.
Well, sometimes people just don't want to reach out to the doctors because they think they're busy, or they need somebody that has gone through those same issues and has the experience.
They also help with connections to the community, with resources for food shelf, for English as a second language.
I'm very thankful for all the peers for the time they take to be there for the moms, and just want to let the moms know that we're here. We're also mothers, so we know what it's like. So it's just really nice to help each other in a way, and as you're learning, we are also learning too.